So my name is Wilson Mui, and I am a part of the Carnegie Mellon Heinz School of Public Policy and Management. I'm doing my master's here, and my focus is in drug policy reform. I am not a Pittsburgh native. I'm originally from New York City, but I've lived in a number of different places. I went to school in Los Angeles, or near Los Angeles, after which I lived there for a while. I moved back to New York City for a little bit as well, and then I moved to Thailand for about 4 years. And then I came back, and then that's when I decided to go to grad school. I think for me, health activism is, well, first off, I don't know if I can give you a definition exactly, but I think somewhat recently, as I've gotten older, I've kind of seen how important healthcare and medical care is, and I think maybe I've had some experiences in my life recently where, you know, I've either me or my family has gone into the healthcare industry. You know, somebody's gotten sick, and I kind of see how important it is that the quality of care is high levels and empathetic, and it's caring and all that stuff, because you're kind of really in a very vulnerable situation. And I think for me, why it kind of interests me is that I think there's a lot of potential to improve people's healthcare experience, and I think there's a lot of barriers to that as well, which is why I think there needs to be activists to kind of push for these types of changes. And it's not really, some of these changes are not small, some of them are quite big. So that's why I think there requires activists to kind of push the forefront of what we do. Well, my passion is drug policy reform, so that's what I'm studying about right now, or studying on. In particular, I think what the area of drug policy that I'm interested in is in illegal drugs right now, and that's mainly because I think there's a tremendous potential to use those drugs for benefits. So, for example, right now there's studies going on dealing with using MDMA for PTSD treatment, and it's at phase 3 trials right now. It's run by this organization called MAPS. And it recently got designated breakthrough therapy, which from what I understand, has only been granted to, like, I don't know, a handful of drugs. And one of the reasons why it was designated breakthrough therapy is because it's shown effectiveness for medication-resistant PTSD so far. And it's been one of the few things that has been very useful, and in as little as 1 dose. And when I say that, it sounds like just an academic thing, but in reality, if you think about the number of people who are addicted to opioids, and there's absolutely a relationship between PTSD and addiction, and you see the number of people who are living, you know, they're kind of like half living their life, or they're not really fully engaged with life, those people can get their lives back with this treatment. And this treatment is available. We know, we're pretty certain it's effective, but because of, you know, politics or whatever, we're just, not only is it illegal, we're throwing people in jail for it, and I think that's a travesty. And so I kind of want to, I want to change that, and it kind of angers me that exists, and it's so ridiculous that I think this is one of the few fights that I can kind of attack without any hesitation whether I'm doing the right thing. So when I first got here, I think the Salk Fellowship was one of the first things I saw come through my email. And the Salk Fellowship, I felt like was directly in line with what I was trying to do, which is activism. You know, I think when I first got here, being at Carnegie Mellon, I think I kind of had a self-pressure to maybe go data analytics track because I'm good at math and science, and that's my expertise, and, you know, I'm at Carnegie Mellon, I should do more data analytics. But the truth is, what I really want to do is I want to make change. I want to affect change. And for me to affect change, I think actually my best place to be is not to do analytics, not to program, be some programming code monkey. I think where I best fit actually is as an activist, as somebody who either brings people together, interprets data, and then translates it somehow into policy, or be a legislative director, in some role like that. And I think the Salk Fellowship just fell right in line in teaching me how to do that, and kind of putting me in a connection with the right people. Because I think that's another big part of it, is that a lot of it is just connecting to more people and having that first line of connection, and then knowing how to expand, and from every single node connecting to more and more people. And I think the Salk Fellowship helps me do that, and that's why I kind of chose it. So the project, my project at Salk Fellowship is very specific. So like I said, my goal was to do drug policy reform. And the way I think one of the biggest problems with drug policy reform right now is social awareness about what drugs what drugs are. And the way I see the problem is that a lot of people just have a perception of drugs, drug abuse, drug addiction, drug law enforcement entirely incorrectly. And I want to educate people on what the reality of drugs really is, what a drug user sounds like, what they act like, who they are in the community, and I want to humanize that. So I think one of the best ways to do that is to create a podcast. So what I'm trying to do is create a podcast. It's going to be called On Drugs. And I'm actually working on it right now between the Carnegie Mellon radio station and UPIT radio station, so do a joint venture, where I'm already lining people up to interview people who've used drugs and had positive experiences, people who have used drugs and had negative experiences, people who are experienced with addiction. I have some law enforcement people that I'm lining up, some researchers. Because, well, I grew up in the in the 80s and 90s, and I was a student of DARE, and I was a good student, and I tried to be very ethical, and I worked hard in school, and I bought into everything they said. And I think it wasn't until I got older, even past college, that I started investigating this more. And then the more I investigated, the more I realized not only was my perception of what drugs meant and what they were and the dangers they were and why people do it and the kind of people who do it, all that was changing and different. I saw a different side where to me it seemed like it was incriminating people, and that the reasons why some drugs are illegal and legal, I saw it was less to do with what the drugs did and what the harm was than on which population was using it. So the more I saw it, the more I saw how this issue of drugs is, I think, in a way, a very special topic, I think, even in the realm of politics, where it is something that I think the unethical aspect of it is so blatant to me that I think I don't know if there's another topic that I think is as clear cut right and wrong, and it affects as many people as it does, that I can see. And that's why I really care about this issue. I've actually met this gentleman a couple of times. His name is Ethan Nadelman, and he is the founder of the Drug Policy Alliance. And I've actually had the fortune to interview with him. I didn't get the job, but I got to the final round and I interviewed with him. And when I met him, we were talking a lot about drug policy, and well, maybe I should tell you a little bit about who he is. I think he went to McGill University in Toronto. He was from New York City, and then kind of was, never did anything. And then at McGill, he smoked a little pot, and he said he liked it. And it kind of changed his direction of his life, where it started pushing him towards law, public policy. He became a researcher at the DEA, and he built the Drug Policy Alliance because he saw the inequity in everything. And he did this in I believe it was for the last 17 years. So I think it's about in 2000. So he created this entire organization to fight, the drug policy in this country. At a time when marijuana wasn't legal, there was no movement, where now it's kind of easy to talk about it. Back in the day when it wasn't easy, and where he saw the bigger picture. A lot of these themes that I'm talking about right now about the unethical nature of how law enforcement is, and the idea that drugs which drugs are illegal and legal is more a function of the people who use them than the harm it creates. These are all ideas that I've heard from him, and he has this great way of framing what this battle really is. And I think that's the really important part, is to be able to reframe this argument in not just the logistics, but in a larger scope of the narrative of what's going on in society. So I'm very impressed with what he's done, and just inspired every time I hear him. If I were to answer that very honestly and very maybe personally, I would say it's only part of the answer. I think that the path that brought me to where I am now was quite a winding road. Before I got here, I came out of school with a degree in physics. I worked as an engineer. Then I went into finance. And then I decided to quit because I realized that wasn't what I wanted to do. So I think that personal journey in terms of figuring out what it was I wanted to do is a much more maybe internal monologue. And I don't know if I can really point to specific things that pushed me one way or another, but it was just a constant monologue in my head of what I thought was important to me in my life in terms of how I spent my time, how I spent my life. And there's many different pivots that kind of directed me here. And I guess meeting this guy, or hearing about drugs when I was younger, learning about drugs as I got older in college, those are all just different pivot points. Well, maybe not as passionate as drug policy, but one of the things that I like to do, one of my biggest hobbies, is Brazilian Jiu-Jitsu. And I cannot say enough how much I think Brazilian Jiu-Jitsu translates into life, into how you lead your life, about your own battles with your own ego, about personal growth. And maybe I don't look like a savage type of person, but in Jiu-Jitsu I'm pretty savage. And that's how I like to live too.